Basically, we are going to talk about a very, very hot topic right now. We're in the midst of our so-called second wave of COVID, and it's very important for us to know about the COVID vaccine, which I think a lot of people have had some fears about. And I'm not sure how many of you have received your vaccine so far. I personally have received mine and completed my vaccination 2 doses in early February. So firstly, let's just revise a little bit about what is COVID-19. It is a respiratory illness. So COVID is caused by a coronavirus. And in fact, coronaviruses are present in humans and cause the common cold. As to how COVID-19 came about, the thought is that it might have jumped from an animal, mutated a little bit, and then ended up infecting the humans. And because we are not we're not used to seeing this new and novel coronavirus. So none of us, human population, has any immunity to it, as opposed to our common cold. So you realize that, oh, children tend to get a lot of common colds, but adults, when they get a cold, they recover within about 3 to 5 days. And you kind of only fall ill once or twice every couple of months. And so that is because we actually have so-called herd immunity. A lot of us have encountered the common cold before, and we are all have some level of immunity, so we can actually fight against it and not transmit or pass it on to someone else. So it kind of stops it in the track. However, when you have something new, so then we don't actually have this herd immunity to stop it in its track, and so it just keeps moving around and getting passed along globally. So COVID-19 is a respiratory illness that can affect not just the lungs, but also other parts of the body, and can range from mild to severe disease. The spread is mainly through droplets. So droplets are like saliva particles or mucus from your nose. And if you also touch contaminated surfaces, you touch it and then put it to your nose or your mouth or eyes, and in some cases by airborne routes. Symptoms appear 2 to 4 days after the exposure. So you could have been exposed up to even 2 weeks prior before you develop some symptoms. And the symptoms include fever, cough, shortness of breath, sore throat, runny nose, or particularly loss of smell or taste. So there's a joke circulating that perhaps in the doctor's office, we should just keep a durian. And if the patient can't smell the durian, we should suspect COVID.